I'm Dr. Ian Lane. On today's episode of Bearing Pain, stick around to find out whether trans women who've had their penis and testicles removed for gender-affirming purposes have low or high rates of phantom pain in the now non-existent penis and testicles compared to men who've had tumors removed for cancer. So today's episode is going to be a little bit different because we're still going to review a scientific paper, but more conceptually. I'm going to get less into the statistics and the nerdy stuff and a little bit more into theorizing about this paper. This podcast might be more geared maybe toward clinicians, but maybe even more so toward like parents of individuals with gender diverse identities. So transgender individuals, people who are questioning, non-conforming, non-binary. There is a growing population of young people who are sort of questioning where they fit on the spectrum of gender expression and gender identity, and whether their identity and their expression map onto each other. And it's a complex and evolving space. All that aside, like, we're not going to talk about the science of gender identity here, but we're going to talk about the relationship of gender identity, gender expression, and pain. So there's a new study that was published in 2026, actually a brand new study, released in the journal Pain in their neuropathic section. Pain is the world's leading journal on pain science. There are a couple of them. And basically in order, it's like Pain, Journal of Pain, Clinical Journal of Pain. This is like the top tier journal for pain science. This paper was published by I'll never be able to say this correctly, Schlissio and colleagues, Schlissio, Kugel, and Grasshoff. I'm so sorry if I butchered those names, if any of you are listening. This paper was called Chronic Phantom Pain as a Rare Phenomenon After Gender-Affirming Surgery, a Systematic Comparison Study. And you might want to, and you should ask, what exactly are they comparing here? So what they did is they took about 54 to 55 in each arm of the study, individuals who had their testicles removed, whether because of testicular cancer in the cancer arm, or, so they called it a tumor arm. If there was a tumor and had to be removed, they would take the testicle or testicles, and then they had a gender-affirming group who had their gender-affirming surgeries conducted and had their penis and testicles removed and had a newly constructed neo-vagina. And the question that they asked was, and for those of you who are not aware that this is a thing, in the pain science world, there's a very interesting phenomenon called phantom limb pain or phantom pain. It doesn't have to be a limb in the sense that it doesn't have to be like an arm or a leg. It could be a digit, it could be a finger, it could be a penis, it could be a testicle, it could be a toe. If you have an appendage or a part of your body that used to be there, that's no longer there, the literature shows somewhere between like 60 and 70% of people who experience the loss of an appendage of their body will experience phantom pains or sensations in the digit or limb or what have you that's no longer there. And you might ask yourself, like, if pain and sensory experiences are related to your brain mapping on territory that exists in your body, like you have a finger, you burn it on a stove, you feel pain in your finger, it makes sense because your finger is there. But if you don't have a finger and you can't burn it on a stove because it doesn't exist, can you still feel burn pain in that finger that's no longer there? And the answer is yes. Yes. But why? We don't fully understand phantom limb pain or phantom pain, but there's a part of your body called your somatosensory cortex, which develops in utero. As an embryo, you develop this part of your brain, and it continues to develop throughout your childhood. When you have a fully developed somatosensory cortex, you have this part of your body that's in your neocortex that's right in the middle part of your brain here. I shouldn't say the middle part of your brain. It's on the superficial aspect of your cortex in your brain, right about here. And it is basically this thing people used to call the homunculus. And it's the part of your brain that when your dorsal column of your spinal cord elicits sensations from the body and feeds them back up to your brain, and it travels through your midbrain and up through your thalamus and into your somatosensory cortex. In this sense, there are different parts of this cortical tissue that are mapped, that load on or respond to different parts of the body. So you have very big representations for things like tongue, hands, feet, lips, genitals, because these are areas of the body that we produce a ton of sensations from. We learn about the world through these sensations. And it's this sensory experience that maps on, in this part of our brain, the somatosensory cortex. Where exactly is the sensation from the world occurring? So when you burn your finger on a stove, your brain says in this part of your somatosensory cortex, this is precisely where this nociceptive or painful activity occurred in your body. But when you no longer have that appendage, what that means is that if in 70% of cases you're still going to have phantom pain, there's still a part of your brain that is interpreting this mapping as still being there. It's still a part of you. Now, this is just a theorizing moment because, again, like some of the data on this is kind of squishy and sort of lacking. But essentially, you have this part of your body that's mapped onto a digit or a hand or a limb that's no longer there, or a penis or a testicle that's no longer there. And if you have a sensation of pain there, your brain is telling your body there should be this unpleasant experience, and your brain has this mapped location for where that experience should be, but it no longer exists. And I'm beating a dead horse at this point, so I'll move on. But there's a reason I'm talking about this, and it's because what they did is they took these people who had these tumor resections, so they had testicles removed because of testicular cancer, tumor. They removed them, and then presumably they put some kind of a replacement testicle in for these guys, and then you use this as a comparator arm. Now, how much they should compare to a trans woman who had a gender-affirming surgery is kind of difficult for me to assess. Like, they're not particularly similar in a lot of ways, but this is what they did. And these data are difficult to come by, so good on them for at least looking into the question. And then you had the group who were trans women or assigned male at birth and went through the process of, this arduous gender-affirming process, to be completely honest. And then they get to the point where they have their gender-affirming surgery and their neovaginal reconstruction, and they're in this other group. And the question that the authors had, which is a very interesting question, is what percentage of them are going to have lingering phantom pain where their testicles, or in one of these cases, their testicles and penis would have been? That is a fascinating question. In theory, if you have men who've had their testicles removed or a testicle removed, they have some risk of phantom pain. And then you have trans women who've had their testicles removed. They should have some risk, and maybe it's similar. One would expect a testicle removed is a testicle removed, right? And so perhaps the risk is the same, which is one of the reasons why they conducted this study. And while there was a significant proportion of men who experienced some phantom pain in the testicular tumor group, the gender-affirming trans woman group, they experienced some unpleasant sensations to some degree, but it was a small proportion of the total number of trans women included. But there was only one person out of 54 individuals who experienced unpleasant testicular phantom pain. And that is very interesting because even when mapped onto the other group, they're not equivalent. The trans woman group experienced much less phantom pain. It's hard to know from an epidemiological standpoint the degree to which this is going to be representative of the entire population of trans women, because there's just not a lot of representation in the literature on this topic at all. And so this is the first publication I've ever seen on phantom pain in gender-affirming surgery. This is a first, to my knowledge. And I'm in the space of sexual and gender minority pain research. That's my area of expertise. So this is a landmark initial report by Schlicio and colleagues. But so even compared to their comparator arm, they had much less pain. But think about the general population of people who experience phantom limb pain, or phantom pain, rather. When I first learned about phantom pain, I was taught that it was phantom limb pain. And so for me, my brain just jumps right to phantom limb pain. But phantom pain, 70% of people who have an amputation, a traumatic amputation, let's say, of a digit or an appendage, will have phantom pain. 70%, roughly. Compare that to the, I think it's 1.2%, 1.4% of this admittedly small population of trans women after gender-affirming surgery. It doesn't even compare. So what that makes me wonder, and this is what the authors hypothesize in this paper, is what if the somatosensory cortex development in a trans woman has a lower mapping for their penis and testicles, where other, let's say, cisgender males have a bigger representation, so to speak, in their somatosensory cortex? What if the part of their brain that represents this part of their body is sort of dimmed? What if their somatosensory cortex has a lower resolution representation of their previously male genitalia compared to their neovagina? Or, and this is all speculative neuroscientific hypothesizing. There is no data, to my knowledge, that looks at this question. And even if they did, as someone who's done some significant neuroscientific research in a past life in a psychiatry department, having worked in rodent neuroscience, like really like brain surgery in mice types of research, this is an area that's fraught with statistical challenges. I don't know the degree to which they'd be able to actually demonstrate that this is reliably the case. But if you allow me to hypothesize, what the authors indicate is at least plausible, and I agree with them that it's at least plausible and it should be explored further, is that when you compare these two groups, there is a bit more phantom pain and certainly more phantom symptoms that are unpleasant and uncomfortable for the men in the tumor resection group compared to the gender-affirming trans woman group. But if you think about why that might be the case, again, perhaps there's some relationship with the somatosensory cortex having a lower resolution representation of male genitalia in a trans woman's brain. If that's true, that is powerful for a sort of biological understanding of the sort of gender-affirming process for trans women, and would be really important for us to know as research scientists and clinicians, and certainly has some implications for pain science. So part of this is for clinicians and scientists in my field. You should read this paper. It's a fabulous study. They did a wonderful job. Part of this is for my trans women out there. You're seeing your pain is real, and your lack of pain in this case is also real and very interesting. It might not be representative. Don't take this one study as an indicator that your experience is going to be just like this, because it might not be. We don't have enough studies on trans women to really know whether this is going to hold as a reliable population indicator of this prevalence of phantom pain. But you should know that phantom pain is a possibility, but that it might be a low probability in the end. Now, there are other considerations that are more on the psychosocial and kind of the behavioral and mental health side of things, which is a different consideration. But on the pain science side, This is one very interesting set of findings. In addition, if you're a parent, it might be interesting for you to know that your transgender daughter there might be parts of her brain that actually map on less to a prototypically male brain after all. It could come out that this is not necessarily true in the, strictest sense decades from now. It might be much more nuanced than this. This is a preliminary report, and it is a small study overall, but still done well and robust. Very interesting. But you might start to reflect a little bit on okay, I've dealt with the kind of social and cultural changes and adaptations that my trans daughter has gone through. But thinking about my son becoming my daughter implies that they were always your son. And it might not necessarily be the case. It might be that your daughter was always in there, and that morphologically male genitalia developed, but something about their somatosensory cortex in their brain has represented that quite low because it doesn't fit who they are. And again, that's all a different level of speculation than what this paper can actually show. But there are implications here that I think are important, that are at least worth exploring further, and at least worth considering, especially in the world of phantom pain and pain science and how it might or might not apply to your trans daughter. I'm Dr. Ian Lane. I'm a pain scientist who specializes in sexual and gender minority chronic pain specifically, and develops self-management frameworks for LGBT people with pain, persistent pain. So remember, when you're in pain, call Dr. Lane.